Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Premenstrual Dysphoric Disorder, PMDD. Introduction. Premenstrual Dysphoric Disorder, or PMDD, is a severe form of premenstrual syndrome, or PMS. About 75% of women in their childbearing years who menstruate have some PMS problems. About 2 to 10% of women in this group have PMDD. PMDD causes extreme mood shifts. It can disrupt your daily activities and harm your relationships, but treatment can help prevent and lessen symptoms. This program explains premenstrual dysphoric disorder. It talks about the symptoms and causes of the disorder. It also discusses how PMDD is diagnosed and treated. PMS and PMDD. Premenstrual syndrome, or PMS, is a group of symptoms. These include acne, joint or muscle pain, tender breasts, upset stomach, bloating, constipation, or diarrhea. Other symptoms of PMS include mood swings, fatigue, irritability, food cravings, depression. PMS starts 7 to 10 days before your period. It may continue during the first few days of your period. The symptoms of PMS tend to happen in a predictable pattern, but the physical and emotional changes you have with PMS may be severe one month and only somewhat noticeable in others. PMS problems tend to peak in your late 20s and early 30s. Premenstrual dysphoric disorder is a severe form of PMS. PMDD causes extreme mood swings that can disrupt your daily activities and harm your relationships. About 2 to 10% of women have PMDD during their childbearing years. Symptoms. PMDD can cause you to have mood swings. It can make you feel depressed or hopeless, nervous, anxious, or tense, angry and irritable. Other symptoms of PMDD include problems paying attention and concentrating, fatigue, sleeping problems. PMDD can cause physical problems such as breast tenderness, headaches, joint or muscle pain, swelling or bloating. The symptoms of PMDD can affect your relationships. They can affect your ability to focus at work or school. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. The cause of premenstrual dysphoric disorder is not known. PMDD may be caused by hormone changes related to your period. Depression and anxiety are common among women with PMDD, but not all women with PMDD have these conditions. Hormonal changes that trigger a menstrual period may worsen mood disorder symptoms. Certain risk factors may make you more likely to develop PMDD. A risk factor is something that may increase your chance of developing a condition. Having one or more risk factors does not mean that you will get PMDD. It is also possible to develop PMDD without any risk factors. Risk factors for PMDD include alcohol abuse, being overweight or obese, drinking large amounts of caffeine. Other risk factors include having a mother who had PMDD, stressful life events, lack of exercise. Diagnosis. You will talk to your healthcare provider about your personal and family medical history. He or she will do a physical exam and a psychiatric evaluation to rule out other conditions. A psychiatric evaluation is an exam used to diagnose a psychiatric disorder. A healthcare provider will interview a patient about their symptoms and observe the patient's behavior. Keeping a diary of your symptoms can help you identify your worst symptoms and when they are most likely to happen. This information can help your healthcare provider diagnose PMDD. Treatment. Treatment for PMDD can help prevent or reduce your symptoms. Your healthcare provider may suggest lifestyle changes as treatment for mild to moderate symptoms. Regular exercise can help reduce PMDD symptoms. Cutting back on caffeine can help reduce anxiety and irritability. Try to avoid emotional triggers if possible. Emotional triggers may include arguments or relationship problems, feeling judged or criticized, feeling overwhelmed or having too much to do. Talking to a counselor about your PMDD symptoms and causes of stress in your life can help. Eating carbohydrates and small, more frequent meals may help reduce the severity of mood symptoms. Nutritional supplements may help lessen PMDD symptoms. Taking 1,200 milligrams of calcium every day may help. Talk to your healthcare provider before you take any supplements. Over-the-counter medications like ibuprofen can help prevent or reduce muscle and joint pain caused by PMDD. Taking diuretics, also known as water pills, can help your body get rid of extra fluid. This can help reduce the weight gain, swelling, and bloating of PMDD if exercise and limiting how much salt you eat aren't enough. Treatment for severe PMDD may include antidepressants, birth control pills. Your healthcare provider may recommend antidepressants to help reduce emotional problems. They may also help fatigue, food cravings, and sleep problems. Taking birth control pills stops ovulation and stabilizes hormone changes. This can help reduce PMS and PMDD symptoms. Most women with PMDD can prevent and reduce their symptoms with treatment. Contact your healthcare provider if your symptoms do not improve.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Premenstrual Dysphoric Disorder, or PMDD, is a severe form of premenstrual syndrome, or PMS. About 75% of women in their childbearing years who menstruate have some PMS problems. About 2% to 10% of women in this group have PMDD. PMDD can cause you to have mood swings. It can make you feel depressed or hopeless, nervous, anxious or tense, angry and irritable. Other symptoms of PMDD include problems paying attention and concentrating, fatigue, sleeping problems. PMDD can cause physical problems such as breast tenderness, headaches, joint or muscle pain, swelling or bloating. The cause of premenstrual dysphoric disorder is not known. PMDD may be caused by hormone changes related to your period. Depression and anxiety are common among women with PMDD, but not all women with PMDD have these conditions. Treatment for PMDD can help you prevent or reduce symptoms. Your healthcare provider may suggest lifestyle changes as treatment for mild to moderate symptoms. Regular exercise can help reduce PMDD symptoms. Cutting back on caffeine also can help reduce anxiety and irritability. Most women with PMDD can prevent and lessen their symptoms with treatment. Thank you for using Explain.